Good afternoon. Thanks for joining us across the fence. I'm Fran Stoddard. In the past year, an estimated 4,300 Vermonters were diagnosed with a type of cancer. So today we're going to talk with the director of the University of Vermont Cancer Center about the importance of screening for 4 common cancer types: colorectal, lung, skin, and breast. The UVM Cancer Center is the state's only not-for-profit comprehensive clinical and research cancer center. Since its founding in 1974, the center has been improving and extending the lives of cancer patients by providing critical research, clinical treatments, and community outreach. Joining us today is the center director, Dr. Randall Holcomb. Welcome, Dr. Holcomb. Nice to have you with us again.
It is indeed a pleasure to be here with you. Thank you for inviting me.
All right. So last month we learned that you had the pandemic has had an impact on cancer screenings, and screenings are down. We'll talk about that more in just a moment. But first, what is meant by a cancer screening, and why do screenings matter so much?
Screening is a modality to detect cancer at an early stage. And the reason it matters is because when we find cancer at an early stage, we are much better at curing people. And when it's detected at a late stage, it's much more difficult to get people treatment and get them into remission. So screening is very important to find cancers at an early stage. Some screenings can even detect precancerous lesions that can be addressed before people get cancer.
And one of the most common screenings is the colonoscopy, which is used to detect colorectal cancer. In 2020, there was a 45% decrease in colonoscopies compared with averages in 2018 and through 2019. Colorectal cancer is your area of focus as an oncologist. So this must be concerning to you. And what can we do?
It's definitely concerning. It's understandable why people put off colonoscopic screening. In part, it was because hospitals had to shut down elective procedures because of COVID. But even when elective procedures were restarted, a lot of people were scared about going to the hospital because that's the usual place where you have to get the colon cancer screening, a colonoscopy. Colon cancer screening is very effective. It can find precancerous lesions in the colon, such as polyps, and remove them, and then people don't get cancer. Or it can find a cancer at an early stage. So it's very concerning that people have put off screening because we're worried that people will present at a later stage when it's more difficult to treat.
Sure, and what are the current guidelines for that screening?
So colon cancer screening should now start at age 45. It used to be age 50, but we found that colon cancer rates have been increasing in younger individuals, especially between the ages of 45 and 50. So it should start at age 45. It could include an annual test for blood in the stool, which can be done through your primary care physician. There is a DNA test of the stool, which can be done, but that's only for average risk individuals, not people who have certain issues like polyps or a family history or inflammatory bowel disease. And then the gold standard for screening is really colonoscopy, which typically is performed every 10 years and starts at age 45.
Great. And Vermont's rate of colorectal cancer screening is actually a little bit higher than the actual average, which is good. People actually coming in and doing it. However, there are differences in the rate based on race, age, and location. What does that mean?
Well, we find that the adherence to the guidelines for colon cancer screening are lower in rural areas of the state. That's somewhat understandable. People have to travel. There are also issues with health insurance coverage, for example, for some people, especially in the rural areas. Also, we find that people of color tend to have lower screening rates, and that's certainly true for colon cancer screening as well.
Okay, so we encourage those people still to get these tests. They're important. And how about
Absolutely.
lung cancer? Vermont has a higher than national average 5-year case count, 60% versus 57 nationally, which suggests that lung cancer is an area of focus locally for Vermont and the UVM Cancer Center.
Lung cancer is definitely one of the cancers that we focus on here in Vermont. Our incidence rate is a little bit higher than the national average. Part of that has to do with smoking in some of the counties here in Vermont, especially our rural counties and some up north. But we see more and more lung cancers occurring in non-smokers as well. There are screening guidelines for lung cancer. Typically, those screening guidelines are made for people who are smokers. And we don't have good guidelines for people who are non-smokers. But for those who've been smokers, the guidelines state that people should start getting screening with a low-dose CAT scan or CT scan starting at age 50 if they have something called a 20-pack year smoking history. That's sometimes hard to understand, so I'm just going to give you some examples of that.
Great.
If you smoke 1 pack per day for 20 years, you have a 20-pack year history. If you smoke 2 packs per day for 10 years, you have a 20-pack year history. And if you smoke half a pack a day for 40 years, you have a 20-pack year history. So we know that the incidence rate of lung cancer from smoking goes up significantly after that 20-pack year mark.
Great. And so that's something to talk to your primary care physician about whether you need a screening or not.
Absolutely. And we do have several initiatives here in the state related to lung cancer screening. First of all, here at the University of Vermont Cancer Center, we have a very robust tobacco prevention and tobacco cessation research program, which is trying to get people to stop smoking. We also coordinate with the Department of Health, Vermonters in Action Against Cancer, and also have a collaboration with Norris Cotton Cancer Center at Dartmouth to try to enhance the rates of lung cancer screening here for Vermonters.
Terrific. And if you're just joining us, I'm talking with Dr. Randall Holcomb. He is the director of the UVM Cancer Center, and we're discussing the importance of early detection and screening for common cancer types. And another cancer that has higher prevalence in Vermont is melanoma, or skin cancer. The national average is 23%, and Vermont's rate is 38%. Do we know why?
Well, we don't know precisely why. Certainly, we have many fair-skinned individuals here in the state, and they're definitely at more risk for melanoma than darker-skinned individuals. People tend to be active and out in the sun, and sun exposure is certainly a risk factor as well. But this is an area for research here at the University of Vermont Cancer Center to try to really find out what the other mechanisms may be that are contributing to the increased rate of melanoma. We do see a lot in this state, and so it is important for people to get screening. If they have any history of skin lesions or moles, they should get annual screening to look at those to make sure that there aren't any abnormalities. The warning signs for melanoma are really if you have a pigmented lesion like a mole that's increasing in size or growing, or starting to bleed, or like this picture shows, has irregular borders or light and dark areas. Certainly if something new pops up that hasn't been there before, these are all warning signs that you should go to your primary care physician, who may refer you to a dermatologist for further evaluation.
Okay, but you again can start with your primary care physician. Let's also review breast cancer. If breast cancer is detected early, what is the rate of survivorship? Pretty good, huh?
98%.
Wow.
So if you detect it at the earliest stages, you know, most women can get cured. That's not every person, and certainly there, you know, people know of anecdotes of people who've been caught early but have a particularly aggressive form of cancer that sometimes creates more difficulties. But really, catching it early is by far the best way to get women cured of breast cancer.
So here's an example of a mammogram. So early detection certainly is critical for someone who has never had a mammogram. Talk about what they might expect.
Well, a mammogram is basically an X-ray test. It's a low-dose X-ray, so people shouldn't worry about the X-rays themselves causing problems. Some people worry that the X-rays might cause cancer, but that's not been shown to be the case. So it's really a safe test. It images the breast and looks for abnormalities. There can be calcium deposits that occur when cancer develops. There can be some increased density of the breast in a particular area. These things would indicate that there might be a problem and might lead to other tests, such as an ultrasound or an MRI or even a biopsy, if something like this is found. So it's important to get the mammographic screening. That's really the first line. That's recommended now for women between 40 and 44. They should talk to their primary care physician about whether they should have a mammogram or not. Certainly, it's absolutely recommended to be done annually between ages 45 and 54, and every 2 years for ages 55 and up.
And I can attest it's easy and everybody's very pleasant who does that work. So the key takeaway is screening is very important, especially for people who might delay screening or have delayed because of the pandemic. What steps should viewers take if they are eligible and should be looking at screenings?
Well, all the viewers now have a little information about screening, and they may know that they qualify for various types of screening. They shouldn't put it off, because finding cancer early is really the key. If you're unsure whether you can qualify for various screening tests, talk to your primary care physician. That's the easiest way to do it. You could certainly send us a message through the University of Vermont Cancer Center at vermontcancer.org. That's our website. There are various resources here in the state that people can use if they don't have adequate health insurance for screening. There's a You First campaign through the Vermont Department of Health, which offers free screenings for breast and cervical cancer. You can call the Department of Health at 800-464-4343. There's also a colorectal screening program through the Department of Health. And Cancer Services Program of Northeastern New York also covers the costs of breast, cervical, and colon cancer screenings for people who are uninsured in New York State. That number is 866-442-CANCER.
Thank you, Dr. Holcomb. This is terrific, and I just we are running out of time, so I just want to point out that you can learn more, of course, at the UVM Cancer Center, vermontcancer.org, through the website. You can also email Dr. Holcomb with any questions, or let the center know if there's a cancer-related topic you'd like to see covered in the future, in a future Cancer Center program. Dr. Holcomb, thank you so much for being with us today. We look forward to learning more next time.
Fran, thank you so much for having me.
And thank you so much for joining us across the fence. I'm Fran Stoddard. Stay well.